Good morning, everyone. This is Dr. Pete Peduzzi with another episode of Disc Talk, and this is podcast number 2. Very excited to be on this great journey doing these podcasts. Again, we did our first one last Wednesday. This is our second one this Wednesday, and I'm very happy to be back with you today to give you some great information. First, we're going to give you a little bit info about our office. This is the American Back Centers and the Disc Relief Centers of Pittsburgh, helping people for over the last 25 years avoid the potential permanent complications with back and neck surgery. And again, we are one of the most experienced facilities in the country instituting this type of care. We have the latest, most effective, most researched technology called VaxD. And again, it's been helping people all over the world, 3,000 patients a day, 300 plus facilities, MDs, DCs, PTs worldwide using this great treatment. There's even VaxD centers in India. We offer it exclusively right here in the Pittsburgh area at the American Back Centers and the Disc Relief Centers of Pittsburgh. That's a little bit about us. If you are new to the office, we've helped people again for over the last 25 years avoid the potential pitfalls and the permanent complications that can result with back surgery and neck surgery. And not all back or neck surgeries, not all spinal surgeries fail, but the great majority have consequences. Permanent consequences when we talk about cutting into you, ripping out ligament, bone, and tissue, causing scar tissue, all types of problems that can come from that snipping off bone and disc that's necessary. Now they take it out because it's bulging or occluding a nerve or causing or contributing to spinal stenosis. We see that all the time, and not all of them fail, but the great majority are not necessary, number one, and they cause more problems than good. You see the Bishop of the Catholic Church, Bishop Zubik, on his 6th or 7th back surgery now. It's just unbelievable, and he's still in pain, still suffering, that great man, and it's horrible to see. And we offer a safe, effective, the most advanced alternative, FDA-approved treatment, non-invasive, non-surgical, right here at the American Back Centers. We have 4, not one, we have 4 computerized artificial intelligence biofeedback technology. That's how it works. It works on electronic biofeedback, artificial intelligence, sensing the patient's body weight and type, very sophisticated computerized treatments that work. And that's really what people want. They want something that's going to work and it's going to help them avoid cutting and surgery and all the potential issues with that. Avoiding medication. We all know that medication is just a Band-Aid. Epidural injections. I just was talking with a patient that was in the office about what we have. Part of our waiting room video has a Dr. Oz piece talking about how epidural injections can be dangerous. They're Band-Aids at best. They're such a money-making procedure for these pain clinics, per se, these pain management centers, per se, making upwards of $2,000 per shot off these, really just, again, Band-Aids. And in some cases, I hate to say this, they learn these techniques at a weekend seminar, and they're told they're money-making procedures for these pain management centers. And at best, they will give you temporary relief at best. There's even a chance if they're even off, if you look at the Dr. Oz piece, you could probably Google it on YouTube. If they're off even a millimeter, it can cause paralysis, all types of permanent complications. Just being off just a tiny little bit with that huge needle. If you ever see the epidural needles, they are huge, huge needles. Off even a millimeter can cause permanent complications. So again, why would you risk this when you have something as safe and effective as what we offer here at the American Back Centers? But today, we're going to be touching on, first, we have a nice article since, you see the leaves are starting to fall. I'm not happy about it because I know I have to go out there and do it myself. Leaves are starting to fall now, and we're seeing, back problems from people working in the yard and so on. So first, we're going to talk about how to prevent yard work from causing back pain. This is from the Cleveland Clinic, very reputable institution. We're going to be touching on that today. You see the leaves falling. You see all the issues with that. Issues meaning you got to go out and clean it up. You got to take care of this now. And, many at this point now, you can probably go out there and run it over with the lawnmower or the garden tractor and just run them over and mulch them up, which in essence is not bad for your grass if you get to a point where you're just mulching up a small amount. Now, if you're getting a large amount of leaves, you have a couple big trees like I have, old trees in my yard, it's fine now, but give it a couple weeks, when those leaves really start falling, the rain comes, the colder weather comes, you're not going to be able to keep up. And when you try to run it over with the lawnmower, you're just going to create a big leaf mess. And it's not going to be good for your grass, and it's actually going to kill your grass. So obviously there's ways that we need to be doing things, using the leaf blower correctly, raking correctly, proper warm up, and so on, proper lifting and bending. We talk about that all the time with our patients. We're going to go into this article a little bit further, talking about, again, some ways you can help avoid back pain when you're doing these type of things out in the yard, raking leaves and so on. So it goes on to state, yards cover millions of acres around our homes, our houses. Many of us fixate on making every inch look perfect. That's fabulous for the appearance of our lawns and gardens. It's often not so great for how our backs feel. Let's read through here. Hours of yard work can leave you with a painful reminder of what it took to get the job done. But you know this, back pain isn't a curse that comes with having a green thumb. So even if you're out there gardening, this article is more specific for gardening. We talk about all types of yard work, tips to avoid aches from yard work. Andrew Bang, DO from the Cleveland Clinic, recommends number one. We tell our patients this all the time. Before you're going to get dirty in the yard, warm up first. Would you hop into a gym workout cold? Probably you wouldn't. As this article states, you definitely would not do that. So, taking the same principle out in the yard as well, doing a few stretches, doing a quick surveillance lap around the yard, just walking around the yard, just checking things out, checking where the branches are, where the leaves are, where there may be a dead animal that you may have to pick up before you get into the yard work. And a few stretches would be a great way to get the blood flowing and loosening up the tight muscles before you jump right in to a project, Dr. Bang from the Cleveland Clinic recommends. Focus on form. We all know this when we're in the gym. Same thing as if we're outside in the yard. Goes on to state, again, the spine is shaped like a S for a specific reason. Dr. Bang goes on to state, it's spring essentially, and it's a spring, he says, essentially, and as gravity is bearing down, the S shape helps disperse the force throughout the spine. This helps keep one disc or one vertebrae from taking over too much pressure. So that's very important. So you're not getting too much pressure on one vertebrae, one disc, and that's how you end up with disc problems, herniated disc. And again, these disc problems don't happen in 1 year, don't happen in one day, I should say, don't happen in 1 week. They happen over a period of months, if not years, where the spine slowly compresses due to the things that we do. And you go out in the yard and do things over and over and over that you have the pain, it goes away, and then one day the straw breaks the camel's back, and it wasn't that one incident. I can guarantee you that. It was not one incident. It was a continuation of incidents over time, and then, again, the proverbial straw that breaks the camel's back occurs, and then you have the severe symptoms. But as you hunch over, this flattening the natural curves of the spine and focuses the weight on the single disc or vertebrae, primarily in your lower back. And that's where your problems start, he goes on to state, Dr. Bang. So it's very important, as they mentioned in the article, to switch things up. One of the best ways to keep back pain at bay is to break up your work routine. Whether it's in the gym, whether it's out in the yard, doing leaves, doing yard work, doing gardening. We get in trouble when we decide to weed the whole garden or rake the whole yard. We try to do the whole garden, the whole yard at once. He recommends doing one job for 20 minutes, then switching to another task for a bit. Go wash the car, or go, do something in the house, load the dishwasher, or go, do whatever you need to do for your kids. This avoids the aches and pains that comes from holding one position for too long. And I tell that to my patients all the time. Sitting at a desk, sitting at a computer, sitting at a cubicle, that's where the problems occur. Driving in a truck, driving in a car long periods of time, not changing positions, not getting up and walking around. That's why we advocate these standing desks. We advocate people that are in trucks and cars, take breaks. I know you can't do that sometimes. Sometimes you have to go on a, 6, 7, 8 hour car ride, or you're a truck driver. You're stuck in that truck. You need to take breaks because that's where the problem occurs. Staying in one position, assembly line worker. sitting in a car, cubicle, whatever it may be, using that standing desk, changing positions, getting up and getting a drink of the water, going to the bathroom. I always tell my patients, don't get fired, but do what you need to do to move around, to change positions, because the problem is when you stay in one position for too long, that's where these faulty postures come into play, and that's where the problems come into play. Whether when we talk about the upper cross syndrome, forward head posture, rounded shoulders, which we address in our office. We do the therapy and the rehab to correct this problem, strengthening the inhibited muscles that are causing the shoulders to come forward, strengthening the inhibited muscles that are causing the head to come forward, bringing it all back and stretching through many different techniques we institute here at the office, stretching the tight muscles to relax all this and bring it all back. But the best way you can address this is by avoiding the prolonged postures in the first place. And the same thing goes when you're outside. Take breaks. Do different things. Use wheelbarrows and garden carts to make moving heavy objects easier so you're not straining your back. Use common sense. Use your legs. Squat down, lunge down. I tell my patients to go on all fours instead of continue bending, picking weeds. Don't do it. Squat, lunge, go on all fours. Garden stools or benches, great ways to kneel. These cushion kneelers can save aches from your knees as well. And using these benches, but be careful that you're not bending too much and keeping your back upright. Squatting down is also important, as we mentioned. Ergonomic tools. Investing in larger curved handled tools can keep you from hunching over. This is particular with a rake. So if you're taller or too small for your tools, this can force you into very awkward positions where you're bending, twisting, and reaching, which of course will irritate your back. So of course he finishes off by saying, protect yourself. Consider wearing a back brace for support. I don't advocate always wearing that, but I tell my patients if you have a disc problem, you go through the program, we fix you up. It's still an area of fragility. Even though you're feeling great and you don't have any pain anymore, I tell my patients still wear the back brace, only when they go out in the yard to do something strenuous, and then take it off after that. We give them an active core strengthening program here at our office. It's a very comprehensive program. They go through the program, they continue doing the exercises at home indefinitely. At least we hope so. And they don't have to do it every day, but you maintain what we've fixed and corrected. But even so, you want to be smart. Put your back brace on when you go out and rake leaves, when you do the garden, and then take it off, because you don't want to be dependent on a artificial brace. We teach our patients to build up a natural back brace, but we also realize it's important to use an artificial brace if you're doing something strenuous, such as a long day of yard work or gardening. Or if you're going on a long car ride, for a good example, sitting in one position for a long period of time. This can help maintain good posture and keep too much pressure from building up on your lower back. And this can also go for your neck too. These prolonged postures that put pressure on the curvature and the neck and the spine itself. So finally, listen to your body. Your body will let you know when you've been overworked. So if your back starts to ache, your neck starts to ache, take a break. Continue doing some walking and some stretching around the yard to reduce some of that delayed soreness that comes on that may creep later. So do realize if you're not used to doing yard work and you decide to just do the whole yard in one day, you may not be sore initially, but you might have trouble getting out of bed the next morning. And that's normal to some extent. I tell my patients soreness is not a bad thing. It's telling you that you've done something. But over soreness or severe sharp pain, especially going down your leg or arm, is not a good thing. That's telling us that you've done something bad, where the spine is now compressed, pinching on that nerve that runs down your leg or your arm, your sciatic nerve, or the nerves that run down through your neck into your arm and fingers and hands. That's telling us that you may have done something to irritate that nerve, whether it's a bulging disc, degenerative disc disease, or just irritation of the nerve, and it's something more than just delayed muscle soreness from a good workout or working out in the yard. So it's a very important note. So very interesting article, especially now that we're seeing the leaves falling outside. And people are going to be out there doing leaves. So we just want to just make sure you're very careful when you're out there, because we don't want to see you here at the office. Of course, we like seeing you here at the office, but we don't want to see doing silly things that are going to hurt yourself like that, and it's totally unnecessary. So we educate our patients. That's why we're doing the podcast, of course, because we know the leaves are falling out there. It's going to look beautiful out there here soon in the fall. All the changing color of the leaves, beautiful. As you go up north, you're going to see it even more so. And I'd say in about a month or so, we'll have, beautiful color out there, if not sooner, into October. But with that, you have leaves falling and yard work to do with that. So getting out in the yard, of course, cleaning up all that dead flowers, dead bushes and so on, trimming them down, pruning them, all takes work as well, bending and twisting. So you want to be very careful with that, because those things can definitely irritate you and create back pain. And we definitely don't want that. And we see it so often with patients that come in here. They try to do things. To help themselves, where they go in the gym and try to, obviously work out, get more fit aerobically as well as strength-wise, and they end up here at the office because now they're hurting themselves, or they look at the guy next to them and they want to do the same weight he's doing. So they do things incorrectly with poor form. They lift a 45-pound plate off the floor at the gym, and all of a sudden now they feel a rip in their back, and now they have pain shooting down their legs. So you got to be careful. Always squat, always lunge, use correct ergonomics and biomechanics when you're at the gym, when you're in the yard, etc. So another article, tips to avoiding back pain from raking leaves specifically. So pretty much the same thing, talking about proper technique, smart approach, raking, and so on. Avoid twisting while raking. We talk about that with just general lifting. Twisting while lifting puts excess stress on the disc in your lower back, especially when done repeatedly. Even a slight forced twist can injure fibers around the disc. Try to keep your back straight and reach out ahead to take the rake. Focus your motion in the arms and shoulders so that you stand and rake your leaves. You avoid the twisting and pulling in your lower back. And get a rake that's appropriate for you, so you're not bending too much, you're not twisting, and so on. A rake that's too big, too small for your size could be a problem. Maybe getting an adjustable rake or the proper size rake. Keep the rake close to your body. We say that too to our patients, whether you're holding a baby, you're holding any type of object, keep the object close to your body when you're lifting. Reaching out or holding a heavy object outward, put more strain on your back. Keeping the rake close to your body, reaching out to grab leaves a few steps away can put you in an awkward position as you pull, and it irritates your back, your mid-back, and your neck. Try not to stand stiffly. Bend your knees a bit. Put one foot just in front of the other. I even tell my daughter this when she's batting. She plays softball. They both play softball, both my daughters, and they do a great job, but sometimes they get stiff. You get nervous. And you just need to bend the knees a bit and relax. Keeping one foot just in front of the other when you're raking leaves now, not batting. This stance helps distribute the weight evenly, which can help prevent undue strain on your knees and back. Maintain one hand position on top of the other as you rake. Occasionally switch which hand is on top to spread the workload evenly between the right and left arms and shoulders. And of course, taking breaks about every 20-30 minutes, as we just mentioned with gardening. Given that raking is such a repetitive motion, doing something else for a few minutes or just resting. Sit on that bench. Sit on the ground. Take a walk around the yard. Just so you're not doing that same repetitive motion is the key. Giving that tired muscle a much-needed reprieve. And again, don't overdo it. It's always tempting to rake the entire yard at once, but there's no harm in splitting the job up over a few days. Those leaves are going to keep falling anyways. And those leaves that you picked up today, they're going to be replaced with new leaves until all those leaves are off the tree. And you know that. And it's unfortunate, but it's a fact of reality of what's out there. There's tons of leaves out there that still have to fall, and it's just beginning. So use caution when moving bags of leaves or dragging leaf-filled tarps. Whatever you're grabbing is probably heavier than you think and has the potential to wrench your back and cause pain. So again, to correctly pick up leaves, bend at your knees. Keep your back straight. Securely grab the bag of leaves. Slowly stand up, maintaining a straight back. Again, using a wheelbarrow or wagon is much easier for you and your back. Other tips to avoid ouchies from raking and fall leaf work. Using the right equipment. Again, choosing the rake that fits you. A larger rake head takes a little more oomph to use, given it grabs more leaves. Select a rake with a handle length that fits your height too. Wearing gloves. Number one, you're going to get blisters and calluses easily by using a rake, especially a long period of time. Getting a good pair of work gloves can help reduce the friction that creates these fluid-filled bubbles. Plus, they'll guard your hands against unpleasant surprises like thorns and bugs as well. And if you're cutting up brush, you're pruning things, you're pruning that rose bush, or pruning those bushes out front, they may have little jaggers in them, as well as bugs and maybe other surprises like yellow jackets or any other animals that may be in those bushes. So wearing gloves is just a safety mechanism as well. Of course, protecting your feet. I can't believe how many people cut the grass in flip-flops. Don't do it. You're going to lose a toe. Comfortable and supportive boots and shoes can help you avoid back pain as well. Don't wear the flip-flops. Don't wear them. They're not good for your back. They're not good for your knees, hips. They're going to cause problems. You don't have the support. Wear a good tennis shoe or support boot. Make sure you have good socks on too to avoid scratches and blisters. Going long, covering your limbs. Long sleeves can keep your arms from getting scratched up, while wearing pants protect your legs as well. And guess what? There's a thing called poison ivy out there. I know it. I get it bad. And I make sure to wash off with cool water. We'll get into that later. But cool water is better than the hot water. Within the first 15 to 30 minutes of exposure. After that, you're screwed. That oil's already latched into your skin. There's not much you can do about it. But again, wearing long pants and a long sleeve shirt will help avoid that. And then you just throw all that in your washer, get in the shower as soon as you get in there to make sure you don't have any oil on you. Staying hydrated. Don't be fooled by cloudy skies or cooler temperatures. Even in chillier weather, you can still have a sweat with that. You can still work up a sweat, I should say, and risk dehydration. So keep the fluids flowing. Drink water. Have a bottle of water out there with you when you're out there doing the yard work, raking the leaves, whatever it may be. Some final thoughts. It's estimated that up to 84% of adults experience some type of back pain during their lives. Once your back is injured, you're more prone to future aches and even the development of arthritis. Because what happens is when the spine starts to compress, that's when the problems start to occur. And the body tries to protect the area by forming bone spurs. Little bony processes that occur kind of like a stalagmite in a cave, and eventually they'll fuse together and you'll have bone on bone. You have fusion of the bone. Very much like you may have in the knee joint, the hip joint. Same thing happens in the spine. We help open that up with our vertebral axial decompression treatment, keeping that spine from compressing, getting the water and the fluid back into the disc, because there's no blood supply after the age of 25, so there's no way for those discs to rehydrate themselves. So when they're being compressed, they're being starved of nutrients and fluids. So how could they get better on their own? They can't. You can go get an epidural, you can go take medication. You can try many things, but you need to address the structural cause of the problem. That's where we come in with VAX-D. We address the structural cause of the problem, open up the spine, and prevent that from occurring. So with back pain, the famous phrase is, maybe it will go away. We hear it all the time. You have back pain, you go take a pain pill, ibuprofen, whatever it may be, it goes away. Then the pain comes back. So once your back is injured, you're more prone to future aches. Again, the development of arthritis, bone spurs, degenerative disc disease, bulging disc, etc. So using proper mechanics while doing yard work or other activities that work your back muscles can help keep you from joining this group of serious, severe back pain. And being here with a disc problem here at our office. Herniated disc, bulging disc, those type of more serious issues. So it doesn't take much to tweak your back and cause a problem. Don't put yourself in a bad position. It's always better to take precautions to help avoid the pain in the first place. Remember, prevention is the key, rather than to try and treat it once it's there. So it's a nice little article I just wanted to pass along to you today. This one, again, both of them from the Cleveland Clinic, talking again about raking leaves and yard work as we see outside. The weather's getting cooler out. We're getting into the fall. We're actually officially in the fall now. And the leaves are falling. It's a beautiful time of the year. It's a nice time of the year. But there's some work involved with it. And you got to be careful not to end up with back pain or more serious back issues, neck issues from doing things incorrectly. All right, I'm going to give you a couple more things here about our office. I do want to highlight a couple of things here as well. We're actually sold out of the Pro EPA supplement, but we have a great supplement for pain, and it's part of our disc protocol. We have some great research. I can just hold it up here from UPMC. Dr. Maroon, who's the Steelers neurosurgeon, has done research on this product called Pro EPA from Nordic Naturals. He found it comparable to Vioxx, Motrin, and Celebrex without any side effects. So we offer that here as part of our natural anti-inflammatory program. We have a great natural anti-inflammatory diet, which we give to our patients as well. I'll have to put it up in a PDF form you can actually print out. So we look at all avenues here, and we have great products. We have a NutriDisc product here, NutriDisc from Anabolic Labs, that helps to rebuild the disc itself. So part of the issue is, rebuilding the fibrocartilage of the disc. It can't really do it on its own, but you want to take advantage of the opening when we open up that spine. And traction can't do that. Decompression can't do that unless you're truly decompressing. Again, anybody can call anything decompression these days. It's unfortunate. We have true decompression. We have the research. Ramos and Martin, Journal of Neurosurgery, 2 neurosurgeons doing studies with pressure sensors on VAX-D only. That's why I say that, because many people claim to do what VAX-D does. And we are the exclusive provider in this Pittsburgh area for VAX-D. And we have the procedure that actually does what it says it does. So again, don't believe anybody. Don't believe me. Do your own research before you pursue any treatment option, including ours. You will see that we have the research, Journal of Neurosurgery, Harvard University, Duke Medical Center, Mayo Clinic, many of the best institutions in the country researching this wonderful treatment we offer here at the American Back Centers and the Disc Relief Centers of Pittsburgh. Visit our website, www.americanbackcenters.com. Again, www.americanback, B-A-C-K, like your back, centers.com. You can actually schedule a consultation right on the website. Call our office, 724-935-3300, if you have any further questions or if you'd like to schedule a consultation. I want to thank everyone for listening today. I hope you got some great info from this article. I hope it helps you. And we'll see you next Wednesday with another podcast. Have a good week.